Dr. Francis Ibrahim Betonsi was employed by the Ghana Health Service on February 23, 2009 and posted to the Fiankwanta Regional Hospital, and subsequently in June 2009 moved to work at the outpatient department of the diabetic clinic of the facility. However, on June 4, 2009, Dr. Betonsi reported one Sarah Atta, a female nurse, to the medical director of the facility, Dr. Paul Ntudi, for unlawful engagement in consulting and prescribing of drugs, selling non-drug consumables, and charging consultation fee against the National Health Insurance Scheme. Dr. Betonsi and Mrs. Atta subsequently had a misunderstanding thereof and resulted in a physical assault and human bite injuries on Dr. Betonsi, which again was reported to the medical director, Dr. Ntudi. Even though a disciplinary committee was set up to investigate the matter, he was later asked to undertake psychiatric assessment by management of the hospital, and after numerous assessments that cleared him, a medical board was again constituted and directed that he undergoes another psychiatric assessment, a decision he challenged and was subsequently suspended indefinitely for 6 years.
Nobody found anything wrong with me mentally, and eventually the Ghana Health Service did not even invite me for any hearing as natural justice demand, based on a petition that I submitted, that the conditions that you want me meet have already been satisfied. You wanted me to have an assessment, but I have done that already in many instances. 3 psychiatric assessments and the final one by the clinical psychologist, who apparently I was referred to see by the psychiatrist, and I have been cleared.
Dr. Betonsi indicated that he further pursued the matter at Commission for Human Rights and Administrative Justice (SRAJ) and the National Labour Commission (NLC) to assert his fundamental rights, which led to his employer, the Ghana Health Service, re-engaging him in 2018. Describing his wrongful dismissal as a crime to humanity, Dr. Betonsi wondered why they refused paying him compensation for the 6 years of unlawful dismissal.
I mean, if you are recalling me back to work after 6 years of staying out of work, it wasn't even about compensation alone. It was also about the fact that the promotions due me were withheld. I had as many as 3 promotions withheld. In fact, I should have been a medical officer in 2012. You understand? But in our time, when you finish the housemanship, you are given that promotion automatically. You don't go for any interview or anything. But they sat on 3 promotions and then pegged me at the level of junior house officer. And on top of that, they dismissed me.
This he prevailed on the National Labour Commission to intervene, arguing that his life after retirement will be miserable if his compensation is not paid.
It's all about just pleading for leniency, okay, and then asking me to forget about the past. But I cannot forget about the past, okay, because this is pain in me. It is pain, frustration for people who decided to conspire to do this kind of callous, heartless, and wicked thing to me. Especially because the person didn't have an issue with you.
For Citi News, Frederick Audi, Bogatanga.